Do therapeutic groups in the community work? Hi, I'm Louise Fouché from OTGrow. Welcome to our YouTube channel. And here we discuss all things group therapy. What was interesting end of last year when we had the discussion with a wide audience regarding the history of group therapy in South Africa, one aspect that was brought up was the idea that we need to move away and not only provide services in hospital or outpatients, but actually move into communities that are in dire need and whose access to mental health providers is really limited. And the discussion went on what type of group should it be? Shouldn't it be different than the groups that we present within an inpatient hospital setting? So I'd like to share some of the findings that came from a project that I was involved in. You must probably know I'm involved with the More Than NPC, and we had a project that was funded generously by the Poole Family Trust. And so for a year long, we worked with two groups of people, leaderships of NPCs within Worcester community, but also early childhood intervention centers, the principles of them in the Worcester and Zwelithemba areas. And before we started the project, we did a baseline assessment, and afterwards we did a reassessment to just see. And we did numerous assessments, but I'd like to highlight three that we did and some of the findings that came out after this year-long project. I'm not going to give too much detail about the project and what it entailed. You're very welcome to go and have a look on our website, www.otgrow.co.za, and there you'll find a blog that gives you guidelines and also tells you more of exactly how we did it. Our contact sessions, we had monthly follow-up, and everything is included in there that can help you to get a really good picture of what we did, and maybe that's something that you want to replicate. So coming back to our assessment, we had three assessments that I want to highlight. The one was the model of creative ability, or the MOCA as it's known, which really focuses on people's drive. People that, what is that inner thing that motivates you? So a pre-assessment or baseline assessment, we did the MOCA. We also did assessment of social cohesion. We had a questionnaire that we gave, and that was worked through with one of the facilitators with regards their experience of social cohesion before and then after the groups. And lastly, the one that I want to highlight is the Warwick Edinburgh mental well-being scale that everybody that came filled in, and 11 months after in our reassessment, they filled out a well-being questionnaire again. And these were the findings. So what I think what's important is that what was quite visionary with Poole Trust, they said instead of just giving money, we rather want to strengthen people in the community and have them strong enough to go and find their own funding. Something up around the concept of if you give a man a fish, you're going to need to keep giving the money. But if you teach him to fish, they're able to find ways and means in themselves. So one of the most meaningful changes I'm going to focus in from now on specifically our early childhood intervention principles from the Zwelithemba and the Worcester area. And so when we started, cumulatively, all the creches had 388 children. By the end of the year, they were providing services to 558 children, which means there was an increase of 43.8% of their service delivery by strengthening these 11 women throughout a year project. The other thing that was considerable in the findings was the increase in resilience of these principles. They also spoke about collective resilience increasing. And so you have this space now of shared problem solving. You have a space of shared resources. So where somebody would say, here's an application for a grant, they would share it among their peers so that everybody could try and apply for some of the grants or fundings that were available. So this created a collective resilience in the group members. What also was very clear in the final report was that there was a strong group-based model which was highlighted as something that made shifts within these women. And this came out in the mental well-being scale, where there was a significant increase in the well-being of the ladies that attended. And that was what was attributed to the cohesion. So a lot of the women eventually called their group my family, my other family, showing how strong the cohesion was. So their sense of isolation and fatigue decreased as they found a place to belong in this group of their other family. The other thing that was highlighted is their self-awareness that increased, which was directly impacted the improvement of communication with their staff, with the parents of the children that attend their ECD. And so there was, because of their sense of awareness, they were able to kind of have feedback and really improve their communication skills. They also gave feedback on mindset shifts that happened inside of them. And in the beginning, where we did an interview, there was a lot of emphasis on we don't have finances, we don't have finances. By the end, their focus was on other things that were bothering them, and their shift was away from just alone being plagued by a lack of finances. Something else that came out was their professional identity that increased, being able to step in and really own the space of being a principal and having boundaries. How is my creche going to work, and what are the criteria and things like that? Their confidence improved, and then their drive improved. And so from a lot of them being very passive participants or just taking things, what was said in the group, there was a shift to becoming much more active participants. And even in the MOCA, which is the model of creative ability, we saw an increase from mostly passive to people moving into imitative and having elements of active participation. So I wanted to share this with you and just contribute to continuing the conversation around should we be having therapeutic groups in the community. So this group had therapeutic elements, but it wasn't solely therapeutic. Those of you that are involved in community, I hope that this has kind of given you a sense of the absolute value of presenting groups in the community where people form their social cohesion, where a lot of mind shifts and drive shifts happen by being in a safe environment in which people belong. And in the meantime, happy facilitation.